Good morning, everyone. So before I start, I just want to put this out there so the people that are watching this, there's 150 to 200 doses at a pharmacy for allocation that you can get to Washington Ave Extension in Glenmont. Walmart is vaccinating, and they have 150 to 200 spots right now. So if you go on their website, you can get vaccinated. So just to give people an idea that are out there. So I want to say that first before I got talking. Also, I do want to thank Senator Chuck Schumer for his outstanding leadership, not just in the state of New York, but through this nation. When I was being president of County Executives of America and NISAC at the time and lobbying for this relief package that we got, it's unprecedented. And we talked about it, but Senator Schumer, thank you. It was signed yesterday. We are entitled to like over $50 million. We're going to get $25 million this year within the next 60 days and $25 million for next year. So all that money is going to be allocated over 2 years, and we can use it for a variety of stuff. So again, to Senator Schumer, to Gillibrand, to all the senators, Delgado and Tonko, for all their work, thank you so much, because without all of you, this wouldn't have been possible. But I want to highlight this key point. This is the first time in our history of this country this aid directly went to counties, state, towns, and villages. Usually it goes through the state. And they made it where it directly goes to us so that we can use it without having to go into the state and begging for the money or just explaining what we're going to use it for. So for that leadership and for that wisdom, and to NACO and to Mike Griffin and Matt Chase and Steve Aquario, and I could go on. There's so many more people. It wasn't just one person. It was a partnership. It was everyone working in a partnership to get it done. Thank you so much. I want to, and please, everyone, there's a vaccine available also at the Washington Armory, so please get on the website, look. Albany is opened up, so, which is good, because we said this before, we have the demand, we didn't have the supply, and now it's starting to open up more and more. So please, everyone, do what you need to do to get vaccinated, do your job, roll up your sleeve, and get us one step closer to opening it up. It's hard to believe it's 365 days later since we have, went into this world. And I can tell you it's been difficult. Everything that we've gone through, everything that we have to deal with going forward, it's been a rough year, not just for our frontline health workers, for everyone. People that had loved ones in nursing homes, people that couldn't go out for 4 or 5 months. It's been a trying year. Trials of tribulations and everything else that was going on around us. And it's been rough, but we've gotten through it. We're almost through it. The light's almost at the end of the tunnel, and we're going to get there. And we're getting there as one Albany County, one capital district, one state of New York, working together, wearing our masks, staying 6 feet apart, coughing into your arms, cleaning your hands. And it's been a rough. I know it's been hard on a lot of people. Mental health, addiction. I could just go on and on and on, and I'm going to go through some of the highlights and stuff that we dealt with, but I do want to say to my workers, thank you. To all my departments that have been out on the front line, thank you. It's not possible without the people in my office, the budget department, the workers I have. It takes a lot of people behind the scenes to make things happen, and for all of us, for Dr. Whalen and I to sit here, to do what we do, to put the information out, there's a team of people. And, it even goes down to the security guard and the cleaners and everyone else that are out there doing their job to keep us moving forward. So thank you so much. So since the beginning of this, it's hard to believe we've done over 200 briefings since this started, and it's been a lot of information to put out there, try to be correct, try to change with the guidance as it came our way, try to pivot when we got information, repivot when it changed a second later. I've always said this, it's their playing field, I'm just on it, they set the rules and I have to adapt to the rules. I decided over 200 briefings ago not to point fingers, not to complain. We could have. But people need leadership, and we need to inspire the people in our community. We need people to come together, and they need to see it starts at the top, and it starts with partnerships and getting through it and relying on one another. And that can't happen if I sat here all day and just blamed everyone. I got elected to lead us through this pandemic, to get us through this economy crisis, and to continue to move government and our services that people depend on, even before this, more now than ever before. And I'm proud to sit here and say it wasn't just me, it was all my commissioners, deputy commissioners, all our workers that kept us going, and pivoted a lot, and changed a lot of ways we've done services, and and the technology we introduced, and having half of our workforce home. So again, please bear with us as we go. We still have a few more months of this, unfortunately. I was hoping September, October, but as we all know, if anyone watched the president last night, he's opened it up to everyone May 1st, to get the vaccine. They're confident there's going to be enough vaccine for everyone by May, June, and that's good news. And we could see some type of normalcy come July, which will be nice, that we won't be doing pods all summer long, that we won't, be going to continue into September, October, and then, that certain radio station can say I was wrong because I predicted October. So I'll be happy about that. I hope I'm wrong. I've always said that. I've hoped what we've been saying here, that it is better. But these are the challenges. And it's been hard to lose 362 residents, in Albany County. Again, my heart, my prayers go out to the families, and goes out to, I believe, the 527,000 Americans that lost their lives in this country to this awful virus. Yes, people have underlying health issues. Yes, they had other problems and complications going on, but you can't finger point at that. It's still tough to lose anyone in your life, whether it was from COVID-19 or whether it was some other way. And my prayers and thoughts go out to everyone in this country and in the world that had to deal with this. So we certainly have come a long way in this last year. And some of these slides, that we're going to be shown, how we started, where we're at, kind of tells the story. But I'll say there's been 21,194 cases of COVID-19 in Albany County to date. We've had 20,671 people that have tested positive for the virus, have recovery, which is good. We have fewer people now being hospitalized or in the ICU, which is also good news. After our first case of COVID-19 we identified in New York, which was March 1st, the governor identified and declared a state of emergency. On March 7th, the state of emergency was declared here in the state of New York. It was March 11th that the World Health Organization officially declared COVID-19 as a pandemic. We were watching it, Dr. Whalen and I were watching it overseas. I was watching what was going on in Italy. We kept referring to that. We're weeks behind them. We saw what happened in Westchester as we moved forward. But sadly, on March 12th, we had our first 2 cases of COVID-19, a woman in her 30s and a college student in his 20s. On March 14th, I declared a state of emergency. So this is also the day the first New Yorker passed away because of COVID-19. That same day, on March 14th, we announced a new partnership with United Way, the Sheriff Apple and District Attorney Soares, to prevent price gouging. And we established a 201 hotline with Pete Gannon. If you look at that slide and you see how we were at our first press conference, who would have knew, Dr. Whalen, right? All crowded at the table, shoulder to shoulder, and that's like I said, we've learned a lot since the beginning, the first press conference. We learned and we evolved as we came through this, and that's the thing that we continue to tell people, that what we were getting in the beginning, as this morphed and changed and we dealt with it differently, things had to change. The way we did business, we had to reimagine the workforce, we had to reimagine everything. 2 days later, on March 16th, schools closed. My daughter has not been back to school since March 16th. I know, Taryn, you're enjoying the virtual reality of being home. She doesn't want to go back. She loves it. But there's kids it affects. It affects parents, single mothers that, and mothers in general that have been home trying to raise their kids, educate them, and still try to work. There's so many things that have happened, and mental health stability of these children, the way it has affected them, it's going to take us years or generations to get back the ground that we've lost of this education loss from March to June of last year, and this year alone. We still have a lot going on. Restaurants could only do takeout services, bars, movie theaters, casinos, gyms, all shut down. You couldn't have more than 50 people at a gathering. No essential state workers, or all non-essential state workers started working from home. Local governments had to cut in-person workforce by 50%. On March 18th, malls, bowling alleys, and amusement parks were all closed. We started to see the direction we're going in. On March 19th, in-person businesses were ordered to cut staff by 75%, and 90-day mortgage relief was announced for New Yorkers. We went on pause March 20th. Non-essential businesses closed, including barbershops, nail salons, and all gatherings were canceled, must stay 6 feet apart. Those 70 years of older were told to stay home and not visit with anyone they didn't live with. A 90-day moratorium was placed on residents or commercial evictions, on commercial and residential evictions. The governor appealed to the businesses to switch gears if they could make PPE. The president declared a major disaster in New York. On March 21st, DMVs closed down. On that same day, I was proud to deliver, though, 5,000 N95 masks to EMS and other healthcare workers in a partnership with a variety of different companies. On March 22nd, hospitals canceled elective and non-elective surgeries to help expand hospital capacities for more beds in ICUs. March 27th, schools were ordered to remain closed for another 2 weeks, and we know where all that went. On March 28th, we announced COVID-19 mental health support hotline, which I thought was important that we get up and establish and running for people to call in to know that the world's changed around them. We started doing things differently. We started taking our parks and recreation and doing YouTube videos and showing kids things on YouTube and different services that we provided throughout the county. We started to deliver things differently to give people still a sense while they're home, how they can do karate, how they can get help, how we can talk to them about mental health and a variety of other programs that we're running. We had to think outside the box. And if I take anything out of this last year is the technology we introduced to the workforce. Because it's government, let's face it, government's hard to change. Government is hard to introduce new programs and software, and we have probably, with our IT department, updated our departments in this county 10 years advanced into the future and got a lot of departments to where they should have been and realized we can do a lot of things remote. And we can do things differently, and we had to adapt. And I want to thank the workers and the unions that all helped out. Jen Clement, our HR director, and everyone that was involved with this in my office. From operations, my deputy, everyone that made this possible. So thank you. We moved the presidential elections. We moved elections. We figured out how to vote, how people could do early voting. We signed legislation and so forth. It was tough. But we got through it, New Yorkers, because we are tough, right? On March 31st, 1,941 New Yorkers had died from COVID-19. Albany County lost one resident, but unfortunately those numbers would dramatically change across the state very quickly. On March 31st, I was joined by the CEO of PVA for a briefing to highlight the transitioning a business to provide ventilators. Companies in our county started to step up, just like the lady, Maxine, that sent me this, thank you, who started making masks, changed their business models, changed and adapted. April 1st, we had the National Guard come in to help get food out to people that were quarantined and couldn't get out into the regional food bank, thank you. All of this stuff happened because we all had to step up and do things differently. We delivered over 5,600 pounds of food through June. Couldn't have been done without the National Guard, the Air National Guard, the Army National Guard, and their leadership, General Shields, and everyone involved, and Ken Secor from our Department of Veterans. Thank you. Thank you, thank you, thank you. We had to redeploy workers to the health department, rearrange what people usually do to do stuff differently to help out what was going on for their tracing and mapping and making phone calls. That we had to visit everyone that was quarantined. We had to get to their house. We had to do daily checks on them. Time consuming when you had over 20, that amount of thousands of people on quarantine to make sure that they're okay. But we did it. We did it in partnership with probation, with DPW, with all workers that we assigned there to help Dr. Whalen and her team out to give double their department so they could do the logistics they need to do day in, day out to keep us safe. On April 4th, medical students were ready to graduate, were allowed by executive order to begin practicing health care and help with the surge. One of the good executive orders was letting EMTs deliver needles so they can help with the vaccine going forward. There's a lot of good things that have come out of this that now we know going into the future, these are things that should stay in place. It works, we need it, and it should have been, it's something that we need to continue to do going into the future. On April 6th, the regional's first mass testing facility, Albany and state officials ahead opened it up, which was good. Our businesses have been shut down for weeks. Albany County has been preparing to report on building our economy. We couldn't even imagine how important this would be when we started working on our CommCare study and doing our Albany County Alliance to open up businesses. And when we started this a year ago, how much this would help out. The other thing we learned through this is small businesses. They suffered with PPE grants. They didn't know how to reach out to their banks to refinance to help them keep open. It's our obligation to make sure that these businesses exist when this is over with. Who thought 365 days later we'd still be doing this? Not I. I thought we'd be in at the end of last year, but as we continued, you could see the numbers where they were going. One of the good things with Senator Schumer's relief package in the Senate and the Congress is that there's relief for landlords, there's relief for businesses, there's relief for hotels, airports. They're getting Senator Schumer's putting another announcement out on the airport to Phil Colorado and his staff. Good job you're doing out there. They're going to get another relief package. Mass transit, everything is getting relief to move the economy forward, and that's the key ingredient for us to continue to move forward. On April 13th, New York joined New Jersey, Connecticut, Pennsylvania, and Delaware, and Massachusetts, and Rhode Island to talk about reopening, the reopening phases that we all went through. We had a lot of fun with that, didn't we, Darryl? The reopening and, phase 1, phase 2, phase 3, phase 4. But on April 15th, we opened the state's first mobile walk-up community testing, and that was so important. We did realize this virus was affecting underlying communities that been neglected for years. And I always get amazed when I did the bomb trains and the opiates that we focus on certain neighborhoods in that snapshot, and when the emergency's over with, we forget about them again. We need to continue to be vigilant, not just talk about equity, not just talk about it. We need action. It's been my motto since I've been county executive. I'm not afraid to take on the bomb trains or the opiates or this issue, but we need to all be in this together, roll up our sleeves, and continue to turn this community around. So what was so important to me as I seen this was affecting the black and brown community was to do walk-up testing. Bring it to their neighborhoods, bring it to their corners, bring it to their churches, bring it to them so we can figure out how this is affecting, how bad it's spreading, and get them the help that they need. And we did that. And I want to thank Whitney Young. I want to thank the Department of Health, everyone and my staff for making this happen. It was a huge success. First in the state walk-up sites. It's good to have mass sites, a drive-through and all that, but you're in a pandemic. Well, you can't Uber or Lyft there, and I think people did, but you're not supposed to. If you don't have transportation, you can't take the bus there because you can't walk around the sites. So it made so much sense to get into these neighborhoods, and instead of just talking about it, making it happen. And I want to say it was good working with Rensselaer and Schenectady, help them do the same thing we did here with walk-up sites. And again, all in a partnership. And I know people are probably sick of me saying, yeah, it's a broken record. But you can't, there's an M&E team. There's no I. There's no I in team, right? We can't do this alone. We can't be about the egos in the room or the politician that thinks they're better than the next person or a commissioner or a worker. It's collaboratively done together. And I hope if any of my workers or the legislature or anyone takes away from this, when we walk away from this, and we will, because we're almost there, is that working together gets things done better than pointing fingers and grandstanding. So to everyone that has made it happen, great. April 20th, I had the honor with a partnership with Rite Aid, announcing with Paul Mahan, our great supervisor of Colony, and Congressman Tonko about testing sites at Rite Aid. April 28th, we set it up with another testing site with Priority One Urgent Care in Gilliland. They've been awesome partners through this whole thing. And then the hospitalizations in Albany County peaked during the first wave, 43 on April 28th. And the following day, we reported 7 new COVID-related deaths from overnight. By the end of April, we lost 16,000 New Yorkers to COVID-19, 41 here in Albany County. We resumed elective surgeries on May 7th. Phase 1 reopening didn't come until May 20th. And then May 25th, George Floyd was killed. And it started unrest and protests across this country. And the message was heard, and we need to change, and we need to hear why people were unhappy with the way things were going. And the only way we can do that is by sitting at the table and letting everyone have a voice. And if you take anything away from all the protests in this country, was that. This voice is not going away, and we are going to do change as we continue to go forward with police reform and everything else, the way we incarcerate, the way we handle things. It's long overdue. And I've said this before, for a country with 330 million Americans, the fact that we have the highest incarceration in any country in the world is disturbing. Doesn't work, hasn't worked, won't work. So the people that think throwing someone in a jail cell works, it doesn't. We need to change our approach, the way we do incarceration, the way we handle criminals, and the way we listen to people. By the end of May, 23,000 New Yorkers had died from COVID-related complications. Of those, 111 were right here in Albany County. Phase 2 reopening started on June 3rd. We entered Phase 3 June 17th. Phase 4 started July 1st, but did not. It was disappointing. They didn't have malls in there. Malls didn't really get to open up, I believe, until like September, somewhere in that time frame, or a little bit later. On July 8th, actually, malls within the region started to meet Phase 4 benchmarks, were allowed to reopen limited. Infections spiked in Albany County on after 4th of July parties, and Dr. Whalen and I sat here for a year. And I think we cringed at every 4th of July, every holiday, and we're like, oh boy, it's going to spike up, because people let their guard down. People started to get COVID-19 fatigue. People didn't being locked up. If you took anything away from staying home for 4 months, people didn't like it. New Yorkers didn't like it. And not just New Yorkers, around this world, people didn't like being quarantined. On August 25th, Albany County launched Shop Local campaign for 5 local businesses owners to encourage residents to invest money in their local communities. New York State Department of Labor announced New York's unemployment rate peaked at 15.9% in July, rising from 15.6% a month earlier. We went from the lowest unemployment rates in our history to having the highest. New York had an annual average of unemployment rate of 10% for 2020, the 4th highest in the country. In the beginning of September, I launched our Stop the Flu campaign with the Department of Aging, which we handed out little cans of soup, hand sanitizer, masks, gloves, and people loved it. And it was a huge success to the Department of Aging for pivoting and changing the way we do things. Thank you. To Department of Aging, working with Rite Aid and setting up a model, not just here in New York State, but across this country, of how we, helping out with vaccines with seniors. Thank you to Deb and her team for turning that around, and I appreciate that. On September 17th, the University of Albany, SUNY officials, and the RNA Institute launched their new pooled COVID surveillance testing, which was pretty cool the way they did that. We had a thing at the airport. Some K-12 schools resumed in-person classroom teaching. October 2nd, after a number of changes, and the U.S. Census Bureau extended its deadline, which we kept fighting for because we know millions, if not billions of dollars are at stake here in Albany County. On October 13th, I released my executive budget and kept the taxes flat for the 8th consecutive year. But we lost over $19 million in tax revenue, which was a huge hit to everyone. I always tell everyone a budget's like a crystal ball. You don't know what's going to happen through that year. There's always something in there that doesn't change. And everyone knows your cable bill doesn't go down, right? Your phone bill doesn't go down. Your internet bill doesn't go down. Your rent usually goes up, and if you got a locked-in mortgage, you're okay. But utilities always go up. And these are things that change people, and it's tough. And it's tough for governments when they rely on this money for their vital services. And They lost money, and we all had to pivot and change. And we did this, though, without laying off people, doing a 0% budget increase, tax increase, and thank you to the ledge, but without laying off people, without cutting services, without cutting vital programs, because people need services and programs more now than ever before. And we have to deliver them services, and we did. And again, to everyone out there in the community, in our workforce, doing things differently, thank you so much. So on October 16th, I hosted a municipality leaders meeting to discuss the executive budget, the opiate crisis, new restrictions on hours at restaurants, and many more things. New York State to reopen on October 17th, a maximum capacities of 25% or more, 50 people in advance. The county, if you look at the 7-day average percent at that time, it had to be at 2% for this to happen, which we talked about sports and everything else opening up. Again, Dr. Whale and I were the messengers, and we followed science. And it wasn't, it's not easy to sit here, I am a politician. That's what I am, and you want to get votes and you want to get reelected. But it came clear to me a year ago, it wasn't about getting reelected. Or I want people happy, trust me. But it was about just putting out the information in a way that people could understand it. They might not be happy if we weren't reopening something. They weren't our rules. Some were, and I will say Dr. Whalen is a medical doctor, so there's things that go into play in that when you're dissecting different laws and different ways of reopening. And I know parents weren't happy, and I know businesses weren't happy. But again, to me, it's about the safety and health of the residents, and I can't put a dollar amount on any of that. No one's more important than the next person. I don't care where you are in the food chain of society. The homeless person is just as important as anyone else, and we have to address them issues to make sure at the end of the day we did it in a safe manner. And I said this many times here, over 200 times, that I have to sleep at night. I got to put my head on my pillow, and I got to make sure I did everything in my damn power that was correct and that protected the people of this county. And I know there's the non-believers out there, and I've said this. My brother-in-law was one of them, Kevin, and so he got sick and ended up in the hospital. And unfortunately, I don't want people to have to get sick and end up in the hospital to understand what's going on. Thank God for the people it didn't affect. I can say that. Thank goodness this didn't bring you down. Thank goodness if you got through this and you weren't doing the right thing and you weren't wearing a mask and you were doing all the things you shouldn't and you didn't get sick, I'm happy for you. I truly am. But to the people doing the right thing and getting us through this, and the flu season being the lowest, and Dr. Whalen can talk about this, the flu season being the lowest it's been in years, right, says a lot. So I do want to say thank you to the people that have been partners. Thank you to everyone that's stayed tough. And we'll all get through this together. So on November 3rd, New York State received a B for institution scores for handling mail in absentee voting. So during the pandemic, we went to voting with absentees, and that was an issue. We had a thing with the delivery of a lot of things and had to do things differently with early voting and so forth and so on. Again, made it challenging, on a way we had to do stuff going forward. On November 9th, Albany County 7-day average for percent positive was 2.5. These are things we started to see. Dr. Whalen and I started talking about the second wave a little bit, or the peak going up in December and January. And, it was unfortunate we were correct. It was December 11th, the first COVID vaccine manufacturer was issued. December 14th, a critical care nurse in New York City was given New York's first COVID-19 vaccine. Our nursing home got its first supply before everyone else and got vaccine not just to our residents, to our workers, to start to open that up. And that same day, I signed an executive order capping third-party delivery fees for local restaurants like Grubhub and DoorDash and everything else. 2 weeks later, New York State Restaurants Association joined me in announcing they expanded EO to cap marketing and other fees at 5%. 1 week later, December 21st, Shaker Rehabilitation Nursing Home, got ahead of myself, got their first dose. 320 doses of vaccine. Christmas definitely came early to our nursing home residents and to the workers. And then unfortunately, we saw the highest amount of death in January. December I thought was bad enough. January really spiked, and it was tough. Our 7 day average positive rate was at a high of like 10.5 on January 2nd, and it made it for a tough winter. The holidays, as I was saying, Dr. Whalen and I cringed to get through, um, which was tough. On January 4th, we opened the application process for Albany County COVID-19 small businesses. We, with the legislature, got $500,000 to give out in grants for small businesses, which was a huge success, because we went door to door with these small businesses and explained it to them. So, to the 132 local businesses that received it, in primarily women-owned and veteran-owned and minority-owned businesses, it was a huge success. So, thank you. And there'll be more relief with the Schumer plan coming forward, right? Unemployment started to drop as things started to open up. We got to 8.2% for the month of December, while Albany County's unemployment rate declined to 5.5, which is all good. On January 1st, Albany County reported 346 new cases of COVID, a single day high, the largest increase we had since the pandemic started. On January 7th, Albany County hosted its first COVID vaccine point of our first pod to Dr. Whalen and her team, who did a great job. I believe that's you up there, Dr. Whalen. I'm not sure. I can't see that far. But again, to you and your staff, thank you for everything you did. On January 19th, I did a unique partnership with Mohawk Ambulance and Mayor Sheehan, and for at-home care, people that couldn't get out. Took a while. We got there. We launched it. It took us another month to finally get the vaccine, to get into underlining communities that people wouldn't come out, the vaccine hesitation, and people that primarily didn't want to sign up online. And it was a huge success. We had over 68% African Americans go through that pod that we held for them for 4 days. And to everyone that was involved, thank you. It was a huge success with Mohawk Ambulance and Mayor Sheen, and we continue to evolve that program and move forward. Continue to argue to get people homebound vaccine. That was a mission of mine, and it took a while, but we moved the needle and we got there working together. So I do want to thank Mohawk Ambulance. On January 12th, we announced that the historic construction of Albany Shaker Place was finally complete, and I have to tell you, I wish when the day comes when we can open it up and when this is all behind us, you can take a walk through there. That place is like a hotel resort, and it's long overdue for people in Albany County to have a place that they can walk around, families can visit with little fireplaces and nooks throughout the whole place and courtyards. It's gorgeous, and families will walk out of there knowing that their loved one is not only getting the best care, but their loved one has some of the best accommodations, I feel, in the capital region. Once you walk through this facility, you will feel like you're at a top-end hotel, and that's the experience we want people to have coming, and the experience for our residents that are there. So thank you to Larry Slacky and the team there and everyone that made that happen. January 15th, the University of Albany mass vaccination site opened up, and I could go on. So we had 89 people pass away in January, which January was a tough month, and I was looking forward to February and things getting better, which is hard. And we delivered the first vaccines with a partnership February 4th with Mohawk Ambulance, like I said. On February 11th, New York reached its milestone of 100,000 first and second doses, which was huge. A second mass vaccination site was opened up at the Washington Army on March 3rd, which is huge, helping more and more people. We've come a long way in this, a very long way. Do we make every right decision? No, I'm not afraid to tell you that. We did not. Did we try? Yes. We're human, right? And do we have to constantly rebuild? Yeah, look at Belichick's philosophy with football, right? You constantly have to rebuild. You constantly have to prepare for the next team or for the next emergency we're dealt with. And my staff, I can't be prouder of in my office. My deputy, Dan Lynch, Counsel Jeff Jameson, Mike McLaughlin, Pat Elders, and George Penn, and Amna, and Luke. I could just go through everyone in my office. And thank you. Because without all of you and everyone in my office, Cam and Mary, it's been a long year. It's been a long year for all of them, 7 days a week around the clock. And to our budget department, then our budget director, Sean Fallon, who then left and went back to the nursing home. We have Dave Riley. And, thank you to everyone in that department, because, again, and to all my commissioners, not just the health department. There were so many things going on this last year, keeping services going and doing differently, from probation to just, you name it, DSS. The people needed more assistance. They needed more heat. They needed more help with apartments or food on the table. Go look at our food pantries. Look at the lines. I'm telling you, if you think you got it bad, go see these food pantries and people waiting hours in line to get food. Please donate food. Please give to the food pantries. Please, please. Help out, volunteer, because there's so many people still this is affected by this. COVID has affected people, and mental health wise. I would like to, I wish I could tell everyone in the room, raise your hand, how many friends you have that you got in stupid arguments with, or people you got in arguments with. You normally wouldn't, because just the mental health of everyone has changed. It has changed everyone. No one likes wearing masks. No one likes staying away from everyone, except one guy I know. Everyone wants to socialize and be with people, right? We want that normalcy, and we're getting there. So, again, it's been a long way. It's been a long way. We've come a long way over this, and we're getting through this by wearing a mask, coughing into your arm, cleaning your hands, and staying 6 feet apart. So those who want to get vaccine, please go to our vaccine sites. Go to the state website. You can call the state hotline, 1-833-697-4829. United Way, as always, 211 for the hotline. Thank you for that. Our pre-registration tool, please go there and check it out. Go to albanycounty.com, and you can see at the top of our website, we'll bring you to our COVID-19, where you can get testing. I know Whitney Young's not doing testing. They switched gears to vaccines. That's a good thing. They're still doing testing at their their facility, but it's limited. So please look at that. The pre-registration list is also being used by other providers, including the state of mass vaccination sites at Washington Army, and everyone else is working together to get this vaccine out. The sheriff's out there doing a thing at the VFW post today. There's other things going on, and this is all good. Every shot we get in someone's arm is a shot closer to opening up and getting back to the world that we used to live in somewhat. But as yesterday, some of the good news, and actually I was hoping it was going to be higher, 26% of Albany County's population has received its first dose. That's still the second highest in the Capital Region, next to Warren County. They're at 28.5. Warren, we're going to catch it. I'm going to make it a deal. But they're at 28.5. We're able to administer 773 second doses yesterday at the Times Union Center. And obviously on Monday, a great story in the Times Union with a partnership with the Latina community. We did 76, which was awesome. Getting the shot. Our nurse, Sel Evers, there, giving it out, which is awesome. So, again, thank you to Dr. Whalen and her team, and to everyone involved with that, getting it done. Dr. Whalen?
It has been a very difficult year. I think that's something we can all agree on, and we talk a lot about how it's affected us from a policy and work perspective, but I think everyone watching this has, in some way, shape, or form, certainly been affected by this, and that's not lost on us. This is something that has profoundly affected almost every resident of the Capital District in one way or another. And it is something that I think and hope we are emerging from slowly together. And I think that is a key thing that I would highlight, that through this year, what I have found is the strength of the partnerships, the strength of the county workforce under the leadership of County Executive McCoy has really been brought to bear. And we have seen the stuff that people are made of, and it's pretty strong stuff here in Albany. So I think that is a success. Collaborations that have occurred that we have planned years for have been brought to fruition with our hospital partners, with our healthcare partners, with our partners in law enforcement and EMS, and these will continue to be incredibly important going forward. We look to expand eligibility for vaccination. As all of you know, the age now has dropped to 60 for vaccination, and on the 17th, we will be able to vaccinate forward-facing government employees and also those that are working with community-based organizations. This is an incredibly important workforce who really every day is key in continuing operations across the county. So all of these expansions get us closer to where we need to be for vaccination strategies. I'm happy on my way in this morning, our epidemiologist sent me some additional statistics on our vaccination numbers in Albany County. And I can share with all of you today that for the 65 plus community, we currently have a percentage of 51.53 Albany County residents that have at least received their first dose. That's a great number.
That is an awesome number.
And it really goes to show the collaborations that have occurred through the multiple channels for vaccination across the county. And we're working very hard with the hub, Albany Medical Center, and all partners to ensure that the vaccination strategies are varied. We know that the strategy that we have employed at the TU pod, at the large-scale pod, has a lot of strength because we are able to get through a large amount of people in a short amount of time. So this is good. We can pull through sometimes up to 450 people per hour to be vaccinated. So as we get supply, we have been able to get vaccine out promptly. And I know I've shared this before. We get vaccine usually on a Tuesday, and most of the time we get it out by Friday. But we always get it out within the 7 days that we are mandated by the state to do this. And that takes a Herculean amount of coordination and work. And, I want to thank my staff in particular for all the work on that. Tricia Bellato and Mary Beth Miller and Shanna Witherspoon and all those that are working at the pod. There's currently a pod going on at the TU Center. We hope to vaccinate 948 individuals this morning. And as the vaccine comes in, we will continue to get it out. Our strategy, we are looking to complement with additional strategies because we also recognize the importance of vaccinating communities in place. People that have, and I don't like the term vaccine hesitancy, but people that don't have confidence in the vaccine, we'll say, are more comfortable getting it in surroundings that they're comfortable in and with people that they know. We understand this, and that's why yesterday's collaboration with Capital District Latinos was such an important effort, and we look forward to doing more smaller breakout clinics and collaborating with partners such as Mohawk Ambulance and our pharmacists, including John McDonald, who are able to get these out into the community. Our supply can be reallocated for those purposes, so it's important for us to continue working with those partners so that we have multiple strategies to get the vaccine out. We want people to be able to be vaccinated in situations that they're comfortable in. This includes doctors' offices and healthcare providers. So as our supply increases, we will be looking for increased ways to partner to get this out. I appreciate the county executive's comments on healthcare disparities and how COVID has highlighted these healthcare disparities. This is something that we at the health department are aware of on a daily basis and is part of our mission to work on healthcare disparities. We know that our Black and brown communities have disproportionate rates of illness and death from COVID, but we also know and knew well before this pandemic that there are higher rates of hospitalization for conditions like cardiovascular disease and diabetes, and that we need to have specialized approaches to deal with these disparities and to get past them. There is much that is involved in that work, and it is the collaborations that we have set up for COVID, I hope can continue in a post-COVID world to highlight those things that we have worked on for so many years. This involves a lot of awareness, and it involves a lot of collaboration across multiple sectors to deal with issues like systemic racism, to deal with issues like poverty, to deal with issues like crime. There is a lot of work that needs to be done so that we can improve the health of all county residents in Albany County and continue to focus on these disparities as we emerge from COVID. From a public health perspective, this is a commitment that I continue to have and will continue to work on. I think we're at the point, I can cautiously say, we are starting to turn a corner. We continue to see decreased rates of disease in the community. I say cautious optimism because I don't have a crystal ball, because I know that there are strains that are out there that are more highly communicable that we have our eye on. There is a potential we could have a resurgence of disease, and it is essential that people realize they need to continue to adhere to the mask mandate and to socially distance. It's also important for those of you that are getting vaccinated to know what it means to be fully vaccinated. I know a lot of people get that first shot in their arm and we see the relief on their faces, and that's a wonderful thing. But please know that that shot does not make you immune. It does not kick in until 2 weeks after your second dose of the COVID vaccine, if that's the Moderna and Pfizer preparation, that you are considered to have full immunity or full benefit of the vaccine. So please, I caution people to act accordingly. We do see people who get COVID after their first dose of vaccine because they're so comfortable and so happy, they feel they can let their guard down. Make sure it's just a few weeks, it's already been a year, so wait till that time passes and continue to wear a mask afterwards until we get to the point of herd immunity. So we're getting there. We're getting there slowly but surely, and every day forward is another day of effort from this entire workforce to get us all where we need to be. It is an effort that requires everyone's input. And I also watched the president last night speak about this and agreed so much with his focus that it's a focus of what you need to do as well as what we can do. It has to be a partnership for all of us. It has to be something we're all working towards together to be able to cross this finish line. It is very reassuring and wonderful news that we expect that there will be enough doses in the United States for all adults by May 1st. We will continue to ramp up our efforts with our partners. We are lucky in Albany that we do have 2 large daily pods through the state DOH and FEMA. And we have so many partners that are willing to step up and assist with vaccines. So as we get the vaccine, we've always said the supply of vaccine should be our rate limiting step. And that is our continued commitment. As it comes into the region, we will get it out. We will get it out to the eligible populations, and we will continue to work towards getting to the end of this so that hopefully, we can be looking at some return to normal in the summer. I do think this has probably changed all of us in terms of how we look at infection control, and that's probably not a bad thing. So I think going forward, people will, in the flu season, heed the messages that we always try to get out to the general public of not going to work when you're sick and washing your hands and trying to keep distance. But I do look forward also to a time where all of us can be together. And that's been a tremendous sacrifice that many of us have made. And I think the sacrifice will pay off if we continue to work together. Thanks.
Thank you, Dr. Whalen. Thank you, Dr. Whalen. And one thing I did forget, a little quick update for domestic travel after April 1st. You do not have to quarantine if you have the vaccine, so that's awesome. But it's after April 1st. We still recommend it, to make sure, but you don't have to after April 1st. International travel is a little bit different. You still have to quarantine if you're doing international travel, but if it's domestic, you do not. So again, some other good things to look at. Please go to our website, albanycounty.com, to register, pre-register, to get your information. So We also want to remind local businesses that we're still giving out free hand sanitizer out at the Times Union Center, so please call 518-447-7040. So if you need any, please call us. The mental health support still available 7 days a week, 8 a.m. to 5, 518-269-6634. And please, I'm going to ask everyone out there, when your time comes, get your vaccine. It's opening up. We're getting plenty of it. Hopefully soon, Dr. Whalen, I think we're getting close, that we'll be sitting here begging people to get vaccines. And as you're seeing more sites open up, that's good. That tells me that the people that wanted it are getting it. Now we have to get the people that might have a little hesitation or whatever the issue may be, or just didn't qualify. We got to get them there to get the vaccine too. So also 211, thank you. The New York State Sexual Assault Hotline number is always ours. 24-hour sexual assault hotline number is 518-447-7716. I do want to give a little shout out to my mom. It's her birthday. She's 96. No, I'm kidding. I think she's 84. I hope she's 84. Mom, you're 84 today. My mother-in-law is 98. But I do want to say to my mom, happy birthday. But please, everyone, do it safely. And I will even say this, and I'm going to throw my poor mom in, so hopefully she's not watching this. She invited everyone over. I go, COVID's not over with. I said, the people that have vaccines can gather now under the CDC guidelines if they're all vaccinated and everyone in that room is vaccinated. You don't have to wear a mask. Doesn't mean it's safe because you got a COVID-19 test. So, yeah, I'll call her up and stop by and knock on the window and say hello to her. But, again, please do the right thing, everyone. We're so close to the end. Thank you.